Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Scleroderma. Introduction. Scleroderma means hard skin. It is a group of diseases that affect connective tissue in the body. This tissue supports the skin and organs. Scleroderma may just affect the skin, but it can also affect blood vessels and internal organs. It may be mild or severe. Various treatments can relieve symptoms. This program explains scleroderma. It talks about what scleroderma is, what it is caused by, and its symptoms. The program also covers the diagnosis and treatment of scleroderma. Scleroderma. Scleroderma is not just one disease. It is a group of diseases. These diseases cause abnormal growth of connective tissue, the proteins that support your skin and organs. Scleroderma causes tissue in the body to get hard or thick. It can also cause swelling or pain in the muscles and joints. Anyone can get scleroderma, but it is more common in women than in men. There are two main types of scleroderma: localized scleroderma, systemic scleroderma. Localized scleroderma affects only skin tissues. It may affect only a patch or line of skin on the body, or it may be more widespread and affect larger areas of skin. Localized scleroderma may get better or go away without treatment, but it can be severe in some people and cause lasting skin damage. Most types of localized scleroderma appear before age 40. Localized scleroderma is also more common in people of European descent than in people of African descent. Systemic scleroderma affects the skin and the tissues under it. It also affects the blood vessels and major organs in the body, including the digestive tract, heart, kidneys, lungs. Severe kidney, lung, or heart problems can happen, but these severe problems are less common. Early diagnosis and monitoring are important. Systemic types of scleroderma are more common in people 30 to 50 years of age. These types are also more common in people of African descent than people of European descent. Causes. Healthcare providers do not know for sure what causes scleroderma. It is not spread from person to person. Scleroderma is believed to be an autoimmune disease. This means the body's immune system mistakenly attacks the body's own tissues. In the case of scleroderma, the immune system is thought to attack cells called fibroblasts. These cells then make too much collagen. Collagen is a protein that forms thick connective tissue. The tissue then builds up in the skin or organs and keeps them from working properly. Healthcare providers do not think that scleroderma is inherited, meaning passed from parent to child, but having certain genes does raise the risk for these diseases. Scleroderma is more common in women than in men. This may be due to hormonal differences between women and men, but more research needs to be done to understand if hormones do play a part. It is also possible that certain environmental triggers can cause scleroderma. Examples of environmental triggers are exposure to certain adhesive materials, exposure to organic solvents, viral infections. But so far, no environmental trigger has been shown to cause scleroderma.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Symptoms of scleroderma can vary from person to person. Symptoms also depend on which parts of the body are affected. One of the most common symptoms of scleroderma is Raynaud's phenomenon. When a person is cold or stressed, Raynaud's phenomenon causes the blood vessels in the hands or feet to narrow. This may cause numbness or pain in the affected area, pale, white, or blue skin. Another symptom of scleroderma is GERD. GERD stands for gastro-esophageal reflux disease. The esophagus carries food from the mouth to the stomach. GERD happens when a muscle at the end of the esophagus does not close properly. This allows acid from the stomach to go back up into the esophagus. Scleroderma often can cause skin changes as well. This can include limited movement due to tight skin, red spots on the hands and face, swollen fingers and hands, thickened patches of skin, especially on the fingers, tight skin around the hands, face, or mouth. Scleroderma may also affect the heart, lungs, and kidneys. This can cause difficulty breathing, extreme tiredness, high blood pressure, irregular heartbeat, shortness of breath, swollen feet. Other symptoms of scleroderma are dental problems, diarrhea, constipation or gas, dry mouth, stiff, painful joints. Diagnosis. Scleroderma can be difficult to diagnose. Other diseases can have similar symptoms. Your healthcare provider will first ask about your symptoms and medical history. A physical exam will also be performed. Other tests can also help to diagnose scleroderma. These include blood tests, skin tests. Other tests may also be done to check the heart, lungs, kidneys, or digestive tract for any problems. Treatment. There is no cure for scleroderma, but treatments are available to relieve symptoms and problems caused by the diseases. Treatment depends on the symptoms a person has. In some cases, localized scleroderma, which only affects the skin, may go away on its own. To help reduce skin symptoms, you can avoid hot baths or showers, avoid strong soaps or home cleaning products, wear rubber gloves if you use these products, use a humidifier at home, use oil-based lotions after every bath or shower, use sunscreen before spending time outdoors. Medicine may also be given to treat some symptoms of scleroderma. For example, blood pressure medications can dilate blood vessels. This may prevent heart and lung problems. These medicines can also treat Raynaud's phenomenon. Certain therapies may also be done. If scleroderma is affecting your movement or ability to do daily tasks, physical or occupational therapy may help. The goal is to improve strength and mobility. Laser surgery may be able to eliminate thickened skin patches that are bothersome. If the lungs are affected by scleroderma, a lung transplant may be needed. This is when the diseased lungs are removed and replaced with healthy lungs from a donor. Other treatments may also be available for different symptoms. Talk to your healthcare provider to learn more. You can also help reduce your symptoms by avoiding foods that give you heartburn or gas, exercising regularly to improve circulation and relieve stiffness in the joints, not smoking. Smoking can worsen Raynaud's phenomenon and other symptoms. Protecting your body from the cold, especially the hands and feet.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Scleroderma means hard skin. It is a group of diseases that affect connective tissues in the body. This tissue supports the skin and organs. Scleroderma may be mild or severe. There are two main types: localized scleroderma, systemic scleroderma. Localized scleroderma affects only skin tissues. Systemic scleroderma affects the skin and the tissues under it. It also affects the blood vessels and major organs in the body, including the digestive tract, heart, kidneys, lungs. Healthcare providers do not know for sure what causes scleroderma. It is believed to be an autoimmune disease. It causes the body to make too much collagen, protein that forms thick connective tissue. The tissue then builds up in the skin or organs and keeps them from working properly. Healthcare providers diagnose scleroderma based on your medical history and symptoms, a physical exam, lab tests, skin tests. There is no cure for scleroderma, but treatments are available to relieve symptoms and problems caused by the diseases. Treatment may include medicines, therapies, or surgery.
Thank you for using Explain.